Welcome to Fun with ECGs. "30 seconds to look for evidence of ischemia." The rate is 60 beats per minute, sinus rhythm, normal axis, and the QRS is towards the upper end of normal at around 110 milliseconds. This is within normal limits. There isn't bundle branch block present. The marked pathology is of severe left ventricular hypertrophy, and we would say that it meets voltage criteria for this. Habitus can be very variable, so it's hard to be sure about left ventricular hypertrophy from an ECG if you have a very slim patient, or if you have somebody who's overweight or severe COPD. Equally, they might have left ventricular hypertrophy which isn't obvious on the ECG. It's associated here with a strain pattern. And let's just go through the left ventricular hypertrophy. There are lots of different measures. I'll do a separate teaching on that, but here we have the S wave in V2, or you could use the S wave in V1, added to the R wave in V5, and we're looking for a total length of over 35 millimeters, or 7.5 small squares. And you can see here it's nearly double that. So voltage criteria for severe left ventricular hypertrophy. There is 3 millimeters of ST depression. You can look at lots of different leads. There is ST depression elsewhere, including the inferior leads. We can look at the deep T wave inversion. And this is again very widespread. Now, there is obviously severe left ventricular hypertrophy and strain, but we can't exclude ischemia. We want to look at a previous ECG for the patient. We want to assess the symptoms. Consider why there would be severe left ventricular hypertrophy. Look for hypertension, hypertrophic cardiomyopathy, aortic stenosis, lots of other conditions. Whenever you're faced with an ECG, it's important to look at the calibration rectangle, and you can see here that it's a normal appearance of this. Often when faced with ECG complexes that are invading their neighbors, which is a good sign that it's left ventricular hypertrophy, the person doing the ECG halves the voltage, and that can lead to a lot of confusion because the ECG can look much more normal and you can fail to spot the hypertrophy altogether. So I find that that's generally speaking not useful to recalibrate the ECG. Certainly it confuses more people than it helps. Thanks for watching.